welcome back again, dear viewers, with our special guest for today. He is interested in the field of cosmetic medicine and plastic surgery. Has been known since ancient times, as the first cosmetic operations appeared by an Indian doctor at the beginning of the 6th century BC. And this field also witnessed a development in the eras of the pharaohs and the Greeks. Since then, humanity has not neglected the role of this operation in improving and the appearance of the human being, this physical and psychological health as well, and giving him a better life. In order to talk more about the differences between cosmetic and reconstructive operations and the latest techniques used in these surgeries, we are pleased to have with us today Dr. Adel Quttainah. He's a consultant plastic and reconstructive surgeon. So hello and good morning, Doctor.
Good morning to you. Sarah, how are you?
It's really a pleasure to have you in our show. Good morning, Kuwait.
Pleasure's all mine.
It's really, let's say, a sensitive and really great, let's say, topic. We are living in the era of plastic and reconstructive, let's say, surgeries.
Sure.
So reconstructive plastic surgery is a delicate surgery. What is the specialty of the plastic and reconstructive
our
surgery?
specialty is called aesthetic plastic reconstructive surgery. So it's like basically two parts that people usually get confused.
Yes.
And it's the reconstructive side and there's the aesthetic side. The reconstructive side is basically helping people with burns, with like craniofacial problems like cleft lips and palates, people that need reconstruction after cancer, upper lip and hand surgery. These are microsurgery. These are all the reconstructive side of our specialty, which actually is like almost 90% of our specialty. 10% is the aesthetic part, is the vein part of plastic surgery, which is like all the cosmetic procedures, as you know, tummy tucks, rhinoplasties, facelifts, all that.
Yes.
So they both constitute the specialty.
That's amazing. So when does the pathological case
when
require such surgeries, Doctor?
When you talk about pathologies, like a good example would be like breast cancer.
Okay.
Breast cancer, like when a lady has breast cancer and then she has a mastectomy, either complete or partial, we have to reconstruct the breast. So breast is out, now we have to think how can we give that patient her breast back. So that's the, we treat the pathology. Same thing with the cleft lip. When a baby is born with a cleft lip, he's got deficient tissues. We have to put the tissues back together and give them a normal functioning lip.
That's amazing, actually. Yes.
As an example.
Yes. So, Doctor, we'd like to know more about the purpose or the goal of the surgeon specialized in the plastic and reconstructive.
Like I said, we try and save lives.
Yes.
Give people a better prospect in life. So again, with the example of the breast cancer, like a lady's femininity depends on a lot on her physical presence and breasts and all that. So when she has cancer, she's already dealing with all the issues of chemo and radiation and all that, and to top that up, as a physical appearance is not, she doesn't feel feminine anymore. So we come in, we reconstitute that breast either through prosthetic replacement or autogenous replacement with tissues from around. So patients that are burned, of course, once we get them out of the acute phase where they're almost dying because of the burn injury and inhalation injury,
yes.
We treat all that, and then you cannot live without skin. So
Exactly.
so we reconstruct the skin and all that. So basically saving lives. People with cancers. But in order for us to remove the cancer, patient will not live. So we have to kind of replace the tissues. So that's the main goal of plastic surgeons.
Well, for sure, it's a very important, let's say, purpose and very important, actually, field. What are, let's say, the latest modern means and technologies used in the plastic surgery nowadays, Doctor?
Again, plastic surgery is an old profession. Depends mostly on the surgeon. So we don't usually depend on a lot of technologies, but it depends on the expertise of the surgeon and all that. We've evolved a lot in in the field of microsurgery with the microscopes that we use to magnify so we can stitch small vessels together.
Yes.
In the aesthetic field, we've evolved with all the machines and laser machines and all that. But as a craft, as surgery itself, it's we're still kind of.
We still,
Yeah.
I heard actually, doctor, that some people are using robots actually for an
Robotic
AI
surgery is a
actually
big thing now.
for some operations. So it's really good.
I mean, robotic surgery is it's in its beginnings, and it's for like cardiac surgery and all that, but it has not evolved to get into the aesthetic field yet. Every
differ from
exactly.
Yes. So, doctor, we'd like to know about, let's say, the successful or success rates depends on specific, let's say, factors.
Yeah, I mean, of course, yeah. I mean, it depends on the pathology. Yeah, some pathologies are very like. Bad that depends on the patient, really.
Depends on the patient. Case and case different from each other.
When you talk about aesthetic surgery, you're dealing with healthy patients, and patients expect to get a 100% result.
Yes.
So success rate is always like high.
That's really amazing, doctor. Now we're gonna have some, let's say, photos in the screen. We'd like from you to explain for us such cases you actually done. We're gonna have display it in the screen.
Okay, so this is the aesthetic part. This is a rhinoplasty. I mean, if you try and analyze this, she had like a slight.
No, it's a plastic surgery.
Yeah, this is rhinoplasty. She had a slightly, dorsal hump. The tip is not defined, mal-rotated. So, you kind of give her a natural look, give the nose a natural look that fits the face.
Yes.
This is a facelift. Again, with the signs of aging, you've got, sagging orthosis of the cheeks, lax neck, undefined jawline, and then of course with our deep plane facelifting techniques, we can bring that patient 10-15 years younger. The trick here is to make them look natural.
Yes,
to make them look exactly the way they looked 10-15 years ago, and not to give them that weird look.
Wow, it's another plastic surgery.
Yeah, rhinoplasty. Yeah, this is the man. Of course, he had really high dorsal hump.
It's a bony, actually, nose.
Yeah. I mean, the hump is mostly bone and cartilage, so
it's really natural, actually, afterward.
Yeah,
yes.
They have to look manly also. Yeah.
Okay, what about this case?
Just an upper eyelid. I mean, with age, you get a sagging eyelid, so that's like really simple surgery that's done in 15 minutes, where you can actually just remove the excess skin and
excess skin from the lid eyes.
From the upper eyelid, yeah.
Wow, that's amazing. And we can, as you mentioned, it's the most important thing is to look natural after the operation. So this is actually the jawline, or?
Yeah, that's a jawline.
Correct me if I'm wrong.
Liposuction neck, and maybe just augmentation of the gonial angle.
And lifting as well?
And lifting, no. I think this case was just liposuction neck.
Wow.
Just a small little incision here.
And the result's amazing, actually.
Yeah.
Wow, that's amazing.
Small things can do a big difference, yeah.
So we are talking about the plastic surgery or the reconstructive.
This is the aesthetic. This is the aesthetic.
Okay, the aesthetic.
This is the vein part.
Okay. So what about this case, doctor? It's about the fat, maybe?
This is a brachioplasty. This is where you actually have to. A lot of patients with all the Mounjaro, Ozempic, people are losing a lot of weight, and then what happens is the skin sags. So they come to us, and we take out the excess skin. It's called a brachioplasty, which is like an upper arm lift, basically.
Yes, and this photo actually explains for us that the aging, actually after aging, we can actually fix everything with the plastic surgery.
Yeah, mostly everything.
That's amazing.
Mostly everything.
Wow, that's really great job, doctor. It's amazing to see that those results actually are really national.
Yeah.
So now we are living actually, or this day actually, in the World Health Day. We'd like from you to actually World Health Day actually today.
Yeah.
So we'd like from you, doctor, to give us some advice or a message because of this day.
I mean, advice with regards to plastic surgery?
Yes, for sure.
I mean, okay, if you're planning to do plastic surgery, if it's aesthetic part, you have to research your surgeon. Make sure your surgeon knows that surgery, but not every surgeon knows everything, So just because he's good in this kind of surgery doesn't mean he's good. So make sure you do your homework on the surgeon, make sure he's properly credentialed, make sure that he knows how to do the type of surgery you want, make sure the facility that you're going to do the surgery in is equipped for an emergency, and just don't go by social media. Really, this is the big mistake that everybody's doing. Nowadays every surgeon, every facility has access to all these platforms on social media, and they just go blindly. Because this guy is Jarrah al-Mashahir, he's famous and all that.
For celebrities, for example,
yeah,
so you're going to be
usually so just go by word of mouth. Make sure that surgeon has done your friends, and you've seen your friends, and you've seen the results, And that's the way you don't fall into any.
That's
problems.
amazing, doctor. Why I ask you this question, doctor, because after we saw the result on the screen, that seems really amazing. And some people are really hesitating to do some reconstructive or plastic surgery, especially, let's say, women after aging, or they have, let's say, a fat or skin loose or so on, but they are really hesitating. They are really scared for getting that step too.
Yeah. They have to do their research.
They have to do their research.
Just go to surgeons that are veteran, that experienced, and the facility is very important.
That's
also.
amazing.
Yeah.
So, doctor, after having those surgeries, so how long does it take, the recovery, let's say, period after
It also
that?
depends on the surgery. Yeah? If you're going for a breast reconstruction, there's so many parts to this. Okay, the first part where you replace the tissue, second part where you do the balancing procedure. So it takes a year almost. Yeah.
Okay.
If you're doing a facelift, 2 weeks and you're fine. If you're doing a nose job, same thing, a week, 2 weeks and you're fine. If you're doing a replantation, say you lost your finger, and you replaced it with another finger, or this will take 6 months to a year. So it depends on the surgery. Really.
Depends on the surgery.
Yeah.
So what are the most prominent, let's say, cosmetic surgeries for men and for women?
I mean, across the board, our bread and butter is liposuction. Liposuction is the most common procedure in the world, and it's the safest also. For women, it depends, like on the age group and stuff like. So we start with liposuction, tummy tucks, nose jobs, breast surgery, facelifts, all that. So women kind of do everything. Men mostly hair transplantation, rhinoplasties, nose jobs, and especially now with people losing a lot of weight, then it's skin reduction surgeries like tummy tucks and 360s, man boobs, gynecomastia.
Yes.
These are the ones that men are getting into this field now more.
Yes.
So we're seeing the numbers of our patients, male patients, increase over the years. So it's almost 20-30% of my patients are men now.
Do you think that they're actually, because of the awareness of that? Because
I think they're fighting for their rights,
Okay.
We have rights too, So they're becoming more aware. That's looking good. Makes you feel good and make you perform
confident and good,
exactly.
actually, for the
and
social
it's not a stigma
appearance.
anymore. It's not a stigma anymore.
It's not a stigma, because it was limited only for the women. When they say plastic
in
surgeons,
the
okay,
past,
it's for only women. But now, as you mentioned, it's really increased. That's really amazing.
Yeah.
So in your opinion, doctor, what are the most important skills for, let's say, a professional surgeon, since you are one of them for sure?
I mean, this goes not just for plastic surgeons, it goes for all surgeons and all doctors. It's integrity. Integrity is very important. To have integrity as a surgeon, I mean, the patient totally relies on you, trusts you completely with their lives and everything. So you have to give them that, And the other thing is, like in our profession, is how to kind of you have to be honest with the patient. You have to tell them what the surgery will deliver, and what they should expect out of the surgery, and not just to try and sell surgery. And to manage patients' expectations, because one of the I mean, as you grow professionally as a surgeon, you get to know when to say no to a patient, not to operate on every patient that you see. Manage their expectations. Some patients have expectations that are not realistic whatsoever.
Okay.
And don't operate on these patients because they'll never be happy. You're not doing them a favor. You're not doing yourself a favor. So,
Yeah, for example, like some of girls bring some famous, let's say, celebrity, and she wants same copy paste for her face, and she's a completely different.
Exactly.
So you stop. You won't be operating on her.
At the end of the day, you want to go sleep comfortably and not worry about patients that's not happy and all that.
Yeah, it won't be satisfied. That's really amazing. And as you mentioned, it's really about the, let's say, psychological point of view, a mental, let's say, point of view. You have to sit with the patient, you have to plant some confidence on them and discuss with them.
You have to worry about patients that come to you when they're on the rebound, like, they've lost their partner, the marriage is collapsing, or they got thrown out of work, and then they just react to this. It's because the way I look, or because this, or because of that. You tell these patients to kind of relax, go back, come back in a month, And usually, don't operate on patients that are emotionally charged. because they will never be happy.
That's really a great point, doctor.
Yeah,
Not all of the doctor can do that, actually. It was amazing, actually, you can give them some space to heal.
Exactly.
And after that, because some people come to you for a case of the depression, they want to change their facial features, actually.
Again, we learn that by experience also, you know.
For
so,
sure.
So.
That's really great point, doctor.
Yeah.
So you speak about, let's say, the burning, after how to reconstruct the burning, the burned skin. We'd like to know more about that, actually.
I mean, burns, of course, you have to, first of all, to try and avoid, is to try and educate people, because we see a lot of burns that come because of they're not well informed, or the families are not well informed of how to protect, mostly kids, how to protect the kids against household burns and stuff like that. You try and get them out of the acute phase, which is like where it becomes their life is in danger, and then they have to deal with all the scars, like, and depending on where the burn is, and like if you have a burn in your neck, you know, when that heals, your neck is going to go down like that. If you have a burn in your elbow is going to go like that. If you have a burn on a lady's, on a child's female breast, her breast will not grow. So, I mean, how to deal with these issues later, we've got many techniques, like from skin grafting to tissue expansion to flaps to regional, you know, it becomes to try and give them functionality, first of all, and that's most important, and then the cosmetic.
But it's curable, actually, in treatment.
Yeah, for the most part,
Yes.
Yeah.
So, doctor, to what extent are the latest, let's say, methods and modern technologies are available here in Kuwait? For sure, in the plastic surgery.
I mean, Kuwait, we have everything. We've got we've got the best surgeons actually here in Kuwait, and you know, we get patients. I get patients from all over the GCC countries. I have patients even from Europe and Canada also that come. So the level of the expertise in plastic surgery is really good in Kuwait.
That's
really
amazing,
good,
actually.
Actually, out of the whole GCCs, Kuwait and Saudi are really Saudi surgeons are also good, you know. So we're
thank God we have such a really great advanced technology here in Kuwait, actually.
Yeah,
so, doctor, tell us or share with us some of, let's say, memorable story about one of the hardest cases actually you've been through.
I mean, there's always hard. Like I remember once when I was a resident in Canada. There's this, which shows you where we can save lives and stuff. Like, of course, Canada is open to a lot of immigrants. Yeah, there was this like family from Bangladesh that came to live in Canada, and of course they gave them a house and they were cleaning the house with the gasoline, and then when they switched on the furnace, the whole house blew up. They didn't know, and of course there was 5 family members, 3 died on the spot, 2 came with like almost 90% burns. And they were, you know, we had to treat them to try and save their lives. But of course, at the end, 90% burn is like almost, you know, and they died also. So it was very hard for me, especially as a resident, because I was just beginning to see this, and I realized the importance of our specialty and how to try and save lives and stuff like that. So, yeah.
That's really a great, let's say, a sad actually story.
It is really sad,
But at the end, actually, you are really a professional doctor. The doctor should be a human being, should be a human, actually, and before being actually practicing whatever he's practicing. Thank you so much for being with us,
Thanks
doctor.
for having me. Yeah.
Thanks. Big thanks and appreciation to our dear guest, Dr. Adel Quttainah. He's a consultant plastic and reconstructive surgeon. Don't go away, dear viewers. Let's have the silent break, and then we'll move on.